Welcome to Parent Academy Online. I'm Sharlonda Buckman, Assistant Superintendent for Detroit Public Schools Community District. And joining me today is our Chief Health Officer, Elliott Attisha, and we're going to have a conversation with you about what's happening with health in Detroit Public Schools Community District. Welcome, Elliott. How are you today?
I'm great. How are you?
I'm doing well. We wanted to bring you in for a little bit just to help parents understand that we do have a health officer in our district now. Can you talk a little bit about what is a health officer?
Sure. So I'm excited to be here. Thank you for having me. A health officer is someone who serves on the school health team, advocating for a healthy learning environment for our students, making sure that they have the resources they need both in school and at home so that they can show up to school healthy and ready to learn.
Okay, that's great. And I'm actually going to take us back a little bit because I know that you've worked in and around Detroit most of your career. So tell us a little bit about who you are and what brought you to this work.
Sure. So I think my dad wanted me to be a doctor from when I was in my mother's womb, but and of course I resisted. But then I eventually volunteered in a hospital setting and fell in love with health and never looked back. And then
Wow.
I completed my training here in Detroit at Children's Hospital of Michigan and went out into private practice world for about
Right.
10 years. And then found the world of school health with Henry Ford Health System, where for 7 years I oversaw a mobile clinic program that was bringing health services directly to schools in Detroit and children in Detroit, complementing their school-based health program, school-based community health center program. And it was there that I realized the importance of the connection between health and education, and that they're really one and the same. You can't be a healthy learner if you're not a healthy child.
Absolutely. And I remember you and I talking, and you talking about building systems within the district around health and making sure we had basic health information on every child so that
Absolutely.
we could be a support to our families. Talk about where you are with some of those initiatives and what parents should be thinking about at this point in this season in the district.
Sure. So in order to be able to address the health issues that our children are facing, we first need to know where we currently stand. And so with the help of the school health team and others across the district, we have revised our health information form so that it will allow us to get the information we need to make sure that we have resources in place to ensure that children can come to school prepared to learn.
Now, have parents gotten that health form?
They have not. It will
Okay.
be going out hopefully in the next couple of weeks.
Okay, great.
We're definitely excited about that. And once we know what those health issues are, we can then start to make sure that we work towards bringing in any additional resources we might need across the district.
The health form itself, is that coming home to parents in the backpack? Is it coming via mail, or what's your strategy to get that out?
Our hope is to send it home through the backpack as a health packet with a few different forms. But then in addition to that, we hope to eventually include it online so that parents can complete it that way, which may make it easier for some parents.
So now with that information for us, once we get this information from all of our parents for our students, how would that then be used in the district?
Sure. The exciting part for me is that in that health packet, there is a form that asks parents to give us permission to share student information with need-to-know individuals, which includes individuals like the child's health provider, any school-based health center any school-based health partners that we might have, including our school-based health centers, including dental, vision programs, including even the student's teacher, so that we are coordinating services around that child. That information piece is vital to moving forward. And so we'll be able to look at a school and say we have 100 kids with asthma in this school, and then we'll be able to make sure that those kids have an asthma action plan on file, medication that they might need to take as a rescue during the daytime at school. We'll be able to make sure that they have insurance, that they have a connection with a health provider. And for those families who struggle to get the services that they need, then we begin to tap into some of the resources that are currently in the district, including our school-based health centers.
So this is all about making sure parents get us basic health information for their children, and then that we can share information even with the child's doctor. If they get sick in school, or if we discover anything, we can share with the child's doctor. But then, as you just mentioned, coordination with in-school services as well as external resources or partners.
Absolutely. That coordination piece is vital. And one of the exciting things for me when I came onto the district was to see the whole child as one of the 5 priority areas in our Blueprint 2020. And when you look at the whole child, it is 10 components of including school health services, but that's just one.
Right.
Unless we're including all 10 of those pieces as we focus on the whole child, in the end we will be a Band-Aid in terms of our impact. So I'm excited that we have parent engagement led by yourself. I'm excited that we have all of these different departments, including culture and climate, physical environment, psychosocial focus, which all make up that whole child. And that's what's going to allow us to really, truly make an impact on our students.
When you think about what you've seen since you've been here and as you build systems, what are some of the common health issues that we're seeing in our health-based clinics? And where are the health-based clinics? I know we don't have one in every school yet.
Right.
However, where are we?
So many of the challenges that we see are because we know that our families sometimes can struggle to get to the doctor.
Okay.
So if you look at most neighborhoods in the city of Detroit, they are recognized health professional shortage areas, meaning that there are not enough health providers for the population in that area. And then if you add in transportation barriers, where roughly 25% of our families don't have a vehicle, that's another challenge for being able to get to the provider. And so for many of our students, they may be suffering from a chronic health issue like asthma or diabetes or seizures, but if they're not getting into their provider to get those routine visits and to manage those health issues, then when they get to school, they may not have the medication they need on hand to ensure that they are protected at school, that they can stay focused at school, that their health issue is not distracting them.
So on that issue, before you move on, as you described the gaps, transportation, a lack of healthcare providers in the community, I hear you saying that the first priority is just making sure your kids get their annual physical from their medical provider. But what if one of those barriers is impeding you? Then how do we as a district support you, or what is your recommendation?
And so for me, those who know me know how big of an advocate I am for school nurses. For me, it starts with a school nurse. A school nurse should be in every single school. Though we may not be there currently, our hope is to eventually get there, because a school nurse helps coordinate those services around a child, is that go-to person for families, and can help families get connected to the resources that they need for their child.
Resources including a healthcare provider, but also insurance sometimes is a barrier in making sure that they can qualify for. How many of our schools actually have nurses now?
So we have 17 DPSCD RNs, nurses. 9 of those nurses are outreach nurses that each cover somewhere between 12 to 15 schools. And then in many of our schools, we have an RN or an LPN or a medical assistant that are there handling sometimes one-to-one students who need day-to-day intervention. They may be there handling issues that come up on a daily basis from students at that school. But then there are many schools that do not have that health support. And so our goal is to eventually get there. And that obviously won't happen overnight. But we are grateful for the nurses we do have. Our hope is to continue to expand on that. And then if you look at the number of school-based health centers that we have, there, if you combine each of our school-based health center partners, we have a school-based...
Who are our partners?
So our school-based health center partners are St. John and Henry Ford.
They've been with us for a long time.
And Institute for Population Health. And we continue to work towards expanding the work that they're doing in our schools. And together, between all of the different partners, they're in roughly 20 different schools. And then in addition to that, we have other partners, including vision and dental and behavioral health services. We have behavioral health agencies that are in many of our schools, supporting the work that our social workers and our counselors and our nurses are doing inside our schools.
When you think about, so if I'm a parent and I'm watching right now, what are the things that I should be thinking about for my child? You mentioned one, there's a health care form coming home really soon.
Yes.
So I should be watching for that. I should get that in so that we can provide the best support and service to your child. What are the other things I should be thinking about? This is also the fall season. Like,
Yes.
what should I be doing?
Sure. So as we get into the fall season, you know, the flu is going to increase in number, and so, and not just the flu, many other communicable diseases. And so we want to make sure that families are taking the necessary precautions. In addition to making sure that your child is getting their annual physical, making sure that your children are up to date on their immunizations, including the flu vaccine, which we're excited to soon be conducting a flu drive that will hopefully allow those children who haven't received the flu vaccine to get theirs and protect them through the flu season.
And that will take place in the schools, or when you say a flu drive, what does that look like?
So the flu drive is being supported by Health Heroes, and we were introduced to them through our Detroit Health Department, and they will be coming into the schools and going from school to school to school providing the flu vaccine to students. But parents need to first complete a consent form that is actually going home today at most of our schools. And if they can get it back to us, hopefully by tomorrow, then we can start to figure out how many kids are actually in need of the flu vaccine, and then starting next week.
So that's going to be at no cost to families.
Correct.
Do they have to provide proof of insurance or anything like that?
The form does ask for insurance, but if families do not have insurance, children will not be turned away, and so and there will not be any cost to the vaccine. Which is exciting.
So that's the flu vaccine, and you also mentioned immunizations.
Sure. So all children should be up to date on their immunizations. You know, even though the state recommendations require that kindergartners, 7th graders, and any new children to the district be up to date on their vaccines. We recommend across the board, all children in all grades should have all the recommended vaccines that are recommended by the American Academy of Pediatrics, not just the state required vaccines. Vaccines are a way to protect your child and to keep them healthy. There are many things that families can do to make sure their children stay healthy, and vaccines are vital.
So Dr. Attisha, we have parents in our district who don't believe in immunizations, and what do you say to that?
That question comes up a lot, and yes, the end decision is up to the parents.
Correct.
And if the parents do not want their child to receive vaccines, then they would go through the waiver process, and they would end up at the health department where they receive education around immunizations.
And then they bring that documentation back to the school?
That's correct. For me, the most important part around immunizations is the education and awareness. Research has shown us that immunizations protect children. Vaccine preventable illnesses still exist, and immunizations have helped to protect children from those diseases. And they also help to prevent outbreaks in schools. And so my guidance is to really take that health information around immunizations and make sure that it comes from a valid source as parents decide around whether their child should or shouldn't be immunized.
And so when you think about, earlier you mentioned the flu vaccination, and when you see what's happened with that, what is your experience telling you?
So last year alone, of the children that died from the flu, 80% of those kids did not have the flu vaccine.
Oh, wow.
And so if that isn't a strong enough statistic to help us decide whether kids should or shouldn't be immunized around the flu, I'm not sure what is.
Dr. Attisha, is there anything else that we want parents to know as we close out this segment of our Parent Academy series?
The most important part is that parents are aware of all the different health issues that can interfere with a child's education. And for us as a district to be able to better address those issues and to be able to provide resources around them, it goes back to that health information packet and card that I mentioned earlier. When parents complete that form, along with that form that gives us background on their child's health, there are forms in there that allow a child to use medications at school. But in order for a child to carry medications at school, they need permission from the parent, and they also need an order from their health provider.
So I can't just call up to the school and say, hey, can you just give my child an aspirin or some Pepto-Bismol because they're not feeling well?
That's correct. We need to make sure that both the provider and the parent have signed off on that order before we can proceed. In the end, that protects the child, that protects our staff, and it creates the healthiest learning environment possible.
Absolutely. Parents, our new health officer, Dr. Elliott Attisha, and we look forward to more information on keeping our kids healthy, smart, and strong.
Thanks so much for having me.
Thank you for coming.